Right now, hundreds of kids across Connecticut are experiencing a mental health crisis, and they're landing in the emergency room. The space is often overcrowded and not equipped to help. Dr. Laine Taylor is with me as part of our special report, Kids in Crisis. She's with the Urgent Crisis Center at the Village in Hartford and is trying to redirect families her way for the care they need. Dr. Taylor, thank you for being here.
Thank you so much for having me.
This story already this morning is resonating with parents. I heard from one mom who said, my daughter was hospitalized for a week in December. She's now a patient with you folks. Another mom says they've been waiting for nearly a year to get her son the mental health care that he needs. How would you describe the mental health challenges Connecticut is facing right now?
Actually, this time of year is particularly difficult. Springtime, it is a challenge for kids because school requirements ramp up and the time change, all of that. It's a really hard time for people in general for behavioral health, but this is particularly hard. And that's superimposed on the difficulties we've had since the COVID pandemic of increased anxiety and children struggling with depression and just so many intense emotions.
Folks who may be joining us this morning may be hearing the term UCC for the first time. So walk us through what a UCC is and how they work.
Absolutely. The Urgent Crisis Center, UCC, is this incredibly innovative program that the state was able to develop, and it's the first time anything like this has existed within Connecticut. It is essentially, if you think about urgent care for behavioral health. So if you think about going to urgent care for medical issues, you know, you're able to walk in and get assistance much faster than if you go to the emergency room. Emergency rooms are meant for an immediate emergency, whereas urgent care or urgent crisis center is for a behavioral health crisis. We can support you, help get you connected to care, help you be able to stabilize and then go home as opposed to thinking about going to the hospital.
So let's give families specifics here. When we're talking about a behavioral health crisis, what types of behaviors specifically are we talking about?
Absolutely. It can range anything from kids who have significant depression and anxiety, kids who don't go to school because they're too anxious to go to school, kids who have thoughts about wanting to die or wanting to kill themselves, or kids who have disruptive behaviors where they become aggressive within the home setting or in the school setting.
In our special report that we shared at 8 and will re-air again at 10, we learned that Connecticut Children's Medical Center said they had 1,000 people over a one-year period who could have benefited from the services you're providing. Are we doing enough as a state to make those connections, or is there a gap? What's happening?
I think we can do better. I think we can do way better in that we need to be able to get these kids seen more rapidly and get them connected to care more rapidly. And that is really the beauty of our urgent crisis centers. There are 3 that are community-based within the state, and you can go to any 3 of these no matter what your insurance coverage is, no matter who you are, what your status is whatsoever, and get immediate care and not having to wait and not having to wait overnight or anything like that.
Let's talk directly to these parents who reached out to me this morning. Their stories are in some ways different, but in some ways very similar, who have experienced these crises with their kids. What do you want them to know this morning, or others who may be in similar shoes?
Yeah, absolutely. You can walk straight into any one of these 3 urgent crisis centers. You don't need an appointment. You don't need any anything else except just your youth and yourself. And for example, at the Village in Hartford, we're able to take kids anywhere between 7 a.m. and 11 p.m. Monday through Friday and 3 p.m. and 11 p.m. on Saturdays. And all you have to do is come in and ask for help, and we can help you across a range of issues.
This couch is a privilege for me, and I always try to empower folks when I can to see the success stories that come out of this. What does that mean? Is there a light at the end of the tunnel? What do you want families to know?
Yeah, I think this is one huge step that helps families to be able to get help and recover from intense crises. Many families go through crisis after crisis, and it's because they're using the emergency room in a way that is intended to resolve crisis. Emergency rooms don't resolve these crises, behavioral health crises. The urgent crisis centers are able to help package you up and give you a plan as you go home, as well as assist after you leave with aftercare.
Dr. Taylor, thank you so much for being here. This conversation is just starting. We have a whole bunch of resources right now on our website, fox61.com. New in our 10 o'clock hour, we're going to walk folks through specifically what happens when we walk through your doors, so join us for that. All new in our next hour. Much more to come right here on the Fox 61 Morning News, folks. We'll be right back.